Hello and welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, we are going to talk about what is fascia and what is myofascial pain syndrome. So, have you ever experienced upper back pain, neck pain, shoulder pain, or else pain that is somewhere in your back but it's keeping on constantly moving? It's very quite possible that you might be experiencing something called as myofascial pain syndrome. Even though this is a common problem, but many of us don't know much about it. So in this video, I would like to educate you about this problem. So make sure to watch this video till the end. Let's begin. So friends, basically if you want to understand what is myofascial pain syndrome, you should know at first place what is fascia. Now, fascia is a thin, white color connective tissue that is wrapped around every single muscle of our body. Now, in order to make you understand this in a more simple way, just imagine your fascia as that white structure that's present inside an orange. So if you see an orange, the outer yellow part or else the peel of the orange is your skin. The inner fruit, the flesh, is your muscle, and between this fruit and the outer peel, that white thin structure that you see is fascia. Fascia basically surrounds every group of muscle fiber, every single muscle unit, as well as every group of muscle. Fascia holds the muscles together and allows them to contract and relax. It also provides a sleek surface between the muscle where the muscles can kind of easily mobilize internally and slide against each other. That too without creating any friction, tearing, or causing any other problem. Now, fascia in general is very similar to tendon or ligament, which is a connective tissue. Basically, as ligaments connects two bones, tendon connects a muscle to the bone. Similarly, a fascia will connect two soft tissues. It could be muscle to skin, etc. This fascia, like any other soft tissue or its connective tissue, have variable degree of elasticity, which allows it to withstand deformation and elasticity, due to which the muscle can recoil back to its normal place after elongation. Fascia is also the richest sensory organ of our body as it is in space for the nerve endings to. Fascia plays a major role in our perception of posture, of movement, our proprioception, and our coordination. Whenever we change our posture or move in any direction, the facial connective tissue, the mechanoreceptors in the facial connective tissue deforms and activates the efferent sensory organs, which then sends the information to spinal cord and brain, and in return the brain is able to give us the commands of how the movements has to be performed. Now, whenever there is injury, there is trauma, or anything that's physically affecting the muscle or its body, that leads to loss of physiological properties of the muscle and also brings damaging changes in the body, affects the fascia. Now, when a person experiences myofascial pain syndrome, or else when a person gets myofascial pain syndrome, there is some sort of pathology present in this fascia. Myofascial pain syndrome is a very common problem, and I think almost every one of us experience myofascial pain at some point in our lifetime. So common that it affects our muscles as well as other soft tissue. A person who experiences myofascial pain syndrome will always feel pain, tenderness in a certain area of the body where the pathology exists. A pain and tenderness that's related to myofascial pain syndrome is related to trigger points. So basically, when there is damage to the fascia and there is consistent repeated injury that is happening to the fascia, that leads to the formation of trigger points. Trigger points are to touch painful areas. These are tight knots that you might see or else you might experience in your neck, on your upper back region, on your lower back region, etc. It feels like small bumps, nodules, and knots in your muscles. This trigger point itself is a knot which is actually formed by combination of many muscle segments in that area, which is actually formed by combination of many muscle fibers in that area, which are stuck and are in contracted state. When this muscle fiber is stuck and is in contracted state, the blood flow to that area stops. And when this blood flow stops, the blood flow to the area stops. And when this blood flow stops, the muscle in that area or is the area where the knot is formed doesn't get adequate amount of oxygen that is required. Even waste materials and chemical toxins build up into that area, which irritates the nerve endings that are present in those trigger points, which which at the end or else as a result end up sending out pain signals to the brain. And your brain in response given signal back to the body that that particular area should not move. And that's why that particular region of your body becomes stiff, sore, and you find stiffness and difficulty in range of motion. And this lack of use persists for a long period of time. It causes stiffness into that area, which kind of expands and also affects the surrounding region. Muscles in the surrounding area become tight as they have to work harder to compensate to the weak muscle that has got tight knots present. Compensate the activity of the muscles that have got tight knots present. Later on, these surrounding muscles also develop trigger points, and gradually the pain spreads to other body areas as well. And that's why whenever you experience any kind of upper back pain, neck pain, lower back pain, you constantly observe that your pain is shifting from one place to other. Basically, trigger points can develop on all the muscles of our body. But there are a few common areas where the muscles are more prone to develop trigger points. These muscles are the muscles which are postural muscles, or as muscles which are responsible for us to maintain erect position. So your neck muscles, which are responsible to maintain an erect posture or maintain your neck in correct neutral position, your shoulder muscle, your upper back muscle, your lower back muscle, which are responsible to maintain you in that right erect position, all these muscles are at higher risk of developing trigger points. This trigger point, as I previously also mentioned, is mostly caused by muscle injury, repetitive stress, or its occupation related trauma that happens in the particular muscle due to doing or its performance of repetitive activity, muscle strain, muscle weakness, which is mostly due to lack of activity, poor posture, working or living in cold environment, emotional stress, hormonal or metabolic problem, vitamin D or folate deficiency, or presence of chronic infection. The question arises how you can manage trigger points or else myofascial pain syndrome. Now, the management is usually easy to do and it can be also prevented. So when it comes to management, the gold standard management is physiotherapy. So with the help of physiotherapy, especially electrical modalities like ultrasound, TENS, IFT currents, patients are allowed to achieve a certain level of muscle relaxation and reduction in pain levels. Apart from that, postural changes, giving some additional support to the affected area is the line of treatment which is used in physical therapy. After the pain is reduced, then patient is put into some set of exercises which are progressive exercises starting from gentle range of motion to stretching exercises to strengthening exercises. Apart from that, there are many different therapies like dry needling, vacuum cupping method, wet needling, oral trigger point injection, spray and stretch, acupuncture, acupressure, relaxation therapy, and meditation are certain ways with the help of which myofascial pain syndrome can be managed very easily. Now coming to the prevention part, yes, myofascial pain syndrome can be prevented with the help of certain lifestyle measures. These includes having a regular sleep pattern, making sure that you stay away from stress or else meditate regularly so that stress do not impact your body, making sure that your posture is good, having dietary habits that involve good intake of plant-based protein and vitamins, using ergonomically friendly furniture while working so that you don't land up with work-related injuries are certain ways with the help of which myofascial pain syndrome can be managed. Remember, myofascial pain syndrome is a vast problem. As I said, it can happen in your neck, your upper back, shoulder, or else lower back region. The management totally depends on to what area the problem exists, to what area the problem exists, and to what extent the problem exists. And that's why customization is very important. So, this was hence the customization is very important. Through this video, my intention was to make you understand what exactly is myofascial pain syndrome so that you will have an idea whenever you get myofascial pain syndrome kind of symptoms and you will know that where you can seek help. On that note, I'll end this video here. I hope you found this video helpful. If yes, make sure to like, share and subscribe to Health You channel. I'll see you in another video. Thank you.